Good morning, Chair and members. My name is Ronald Coleman Baeza here on behalf of the California Pan-Ethnic Health Network. CPEHN is a health policy organization that brings racially and ethnically diverse communities together to further and advance health equity. We appreciate the opportunity to be here today to share our thoughts on how we should be responding to coverage losses that will result from H.R. 1 and state budget decisions. Over the last year, the President and Republicans in Congress have made it their top priority to attack immigrants and people of color across our country by their policy actions, through their budgeting, by how they have unleashed law enforcement to kidnap children, families, and workers across our state. We know what their agenda is. We hear the message loud and clear every single day. Immigrants and people of color are not welcome here. But here's the thing. While this is the message being pushed out of Washington, D.C., here in California, we should actually be leaning into our values. We should not be running from them. So you can imagine how shocked and disgusted many people in the health advocacy community were when they saw Governor Newsom's proposal that seeks to eliminate full-scope Medi-Cal coverage for 200,000 humanitarian immigrants across our state. Individuals losing care include survivors who have been granted asylum, people who are often survivors of torture inflicted because of their racial, ethnic, or sexual identity, or even because of their political or human rights activism. Many of these people have endured sexual assaults or trafficking, beatings, or even witnessed the murder of their family members and are often suffering PTSD. Losing full-scope Medi-Cal benefits and only having emergency Medi-Cal means that someone no longer has access to the services that they desperately need. They will lose preventive care, non-emergency dental coverage, and even access to prescription drugs. Essentially, they'll lose access to all non-emergency treatments and not be able to manage chronic conditions, and death could result from an illness that could have been easily treatable or even preventable. While the governor claims that this is the result of a new federal policy change of H.R. 1, H.R. 1 does not automatically trigger Californians losing coverage. In fact, this legislature would have to take a proactive vote to reverse policy and fiscal commitments that have been in place for decades in order to strip coverage away from these people. Both Democrat and Republican administrations have stood by these commitments in the past. Current state law requires these individuals to be covered in full regardless of any changes at the federal level. Enough damage has already been done and has yet to fully be realized as a result of budget cuts that happened last year. We established a freeze that started on January 1st, the carve-out for adult dental for all UIS individuals starting on July 1st, which legislators can actually stop now. We also have the fourth largest economy in the world, our state, asking immigrants in poverty to pay $30 a month in premiums starting in July next year. All of these decisions should be reversed. It's not time to also sock away money in reserves while we're also sitting here considering proposals to strip away coverage from Californians. We also must have some type of dedicated revenue stream that provides funding for Medi-Cal to ensure we have the dollars in the system to appropriately provide for the medical needs for all of our state residents. We need courageous and bold action from policymakers at a time when cuts can actually kill people. While coverage losses may be inevitable, it is incumbent upon you all to ensure we can keep as many people in our Medi-Cal system as possible. At a time when eligibility cuts, work requirements, and more often renewals are put in place to push people out. Investments must be made to ramp up capacity for navigation and eligibility support, specifically using community health workers, promotores, and health representatives as a solution. In this climate, CHWPRs will continue to be a trusted link that help families navigate changes and stay connected to care, preventing eligible Californians from falling through the cracks in a changing Medi-Cal system. CHWPRs have always been a core part of California's health workforce in times of crisis. They rose to the challenges during COVID-19, supported communities through wildfires. California actually already has an infrastructure in place that can be scaled up quickly without reinventing the wheel. In 2025, the Department of Health Care Access and Information, HCI, invested $6 million to strengthen connections between CHWPR organizations and immigrant legal service providers for referrals and linkages to key services. We urge you to build on that existing investment by expanding CHWPR and CBO capacity to provide health navigation at the scale needed during this critical time, both in HCI and through partnerships with counties. Medi-Cal changes will create confusion for beneficiaries and increase the risk of unnecessary coverage terminations due to paperwork and administrative barriers, particularly for communities that already face language access barriers and heightened fear. We must do everything possible to have multiple layers of support for individuals in danger of losing Medi-Cal to keep them covered or find alternative county or local options if they lose coverage. Getting to universality is a California value, and that means fighting for our most vulnerable Californians to make sure we maintain access to coverage, and that is going to require all of you to do hard work. While Medi-Cal already operates more efficiently than other parts of our healthcare system, it's going to be important under these federal threats to make sure that we redouble demands, that public dollars prioritize patient care over any profits in our system. H.R. 1 was the biggest transfer of wealth we've seen in generations. People in poverty lose, while large, rich corporations and the wealthy hoard more resources that legislators should be capturing to make sure we aren't cutting people off of coverage. Let's raise revenue for Medi-Cal. Let's reject additional cuts to strip healthcare from Californians. Let's not cut any optional benefits in these difficult times. And let's ensure that we can do everything we can to invest in community-based solutions through community health workers to make sure that we can prevent people from falling through the cracks. Thank you.